Combining proper nutrition with medical interventions has become an increasingly effective approach in weight loss and obesity management. So we're now joined in studio by NicciRobertson, who is a nutritional therapist and NLP practitioner, to tell us more about how these strategies work together. From a nutritionist perspective, how are you seeing this, we've called it a pandemic of obesity in your space and in your work?
Yeah, well, that is the kind of clientele I attract. So it's everywhere in my life. So everyone who comes to me, or not everyone, but most people who come to me have between 10 and 30 kilos of fat to lose. And most of them have tried every which way possible to do this. And it's actually really simple to lose weight healthily if you understand your body, if you understand where you are in life as far as hormones are concerned, if you understand that it's not a quick fix. This takes a very specific change of mind to start building a different lifestyle. Diets don't work in the long term. Diets are a short, quick fix for a long-term problem. So we have to adjust how we shop, how we think, how we feed ourselves. This takes a lot of work. It's not as simple as downloading a diet off the internet and following a plan or counting calories. We need partnership in these programs. We need to work with doctors, we need to work with coaches, we need to work together to help people become the best they can be and to overcome these are medical issues. So obesity is very much a medical issue. It's not just a case of aesthetics or vanity.
I want to just pick up on something you mentioned earlier. The word we're using here is obesity. And Mark, maybe you can just from a medical perspective explain this. What is classified as obesity versus just mildly overweight?
Obesity is irregular deposition or unregulated deposition of fatty tissue in the body. We don't specifically like BMI. It's a little bit archaic. We prefer to use waist-hip ratio and abdominal circumference. So for the guys, above 100 centimeters abdominal circumference. For women, it goes down to 88. Some of them even go down to 90 centimeters for men and 80 centimeters for women, depending on which area in the world you are.
Okay. So Nicci, now Mark and I chatted a bit earlier about the use of medical assistance or injectables or medications for weight loss. How important is it that somebody engages with a nutritionist, and how do you engage with that process to get them on track and set up for lifelong weight management as opposed to just crash and burn, kill the weight, and it all comes back later?
Okay. So first and foremost, we need to look at these products or these medical interventions as tools. They're not for life. They are for a structured, specific period of time, and they're managed by a doctor. So there's an appropriate, safe use of everything. And that goes for all medication. So how do we maximize the efficacy of any medication is by taking measures to change our lifestyle. So the biggest concern most people have when they ask me, what do I think of these injectables is it sustainable? Am I going to keep the weight off when I stop taking them? That's the first concern. And the second concern is, am I going to lose muscle rather than fat? And the answer is yes, you will lose muscle rather than fat if you don't pay attention to what you're eating and when you're eating and your exercise. So you've got to use these drugs as an opportunity to start changing how you think about food and how you are in the world and how you start treating your body. And because they blunt the appetite, and because they give you a sense of control, and because you're paying big money for these drugs, and you are, there's drive and reason to start going, now I'm going to get my life in order. Now I'm going to use this opportunity to maximize the benefit and make sure that these drugs have long-term efficacy, even when I start weaning off them. And the answer to the first concern most people have is it sustainable? And yes, it is. It most certainly is if you start practicing good dietary or good nutritional habits while you are using them. So if you are losing weight safely and slowly and consistently while on a drug that has been decided by your practitioner that is appropriate for you, and you start eating right and understanding the difference between fats, carbs, and proteins, when I should be eating them, how much I should be eating, then yes, you can take those positive dietary influences through for the rest of your life and keep your weight off. It's quite simple.
So Nicci, are you finding that you actually almost have to go back to basics with people to say, these are the fundamentals of nutrition, and you've got to learn and train the brain?
All the time. All the time. Even with anybody, even people who've done this for years, we always have to go back to the basics, because the basics is what does the job.
Yeah.
Yeah.
So Nicci mentioned something earlier which I really think we need to touch on. Obesity creates inflammation. Inflammation creates hormone dysregulation. So we also start seeing, problems with hormones like estrogen, testosterone, progesterone, thyroid hormone, very, very big problem. So what I experience in my practice when I use these medications is people stop eating. They don't want to eat. The medication is effective. And then the weight loss plateaus very quickly. So initially they're losing a lot of weight, up to 3-4 kilograms in the first month. And it's like, okay, this is going too fast. You're not eating.
Right.
So we track them. And it's because of, like Nicci said, they're not feeding the body. So they're eating something small, a snacky kind of thing, that doesn't give them nutritional, dense.
It's not supporting the metabolic process.
Yeah.
So now they're full, but they didn't get the nutrients in. And now they start breaking down muscle.
Okay.
And if you break down muscle, you release glucose into the bloodstream. It's your muscle is an endocrine organ that controls blood sugar.
Right.
So, and now your body goes into stress. You start pushing up your blood pressure, etc., etc. And when the body starts craving energy, it's going to start craving sweet things.
Yes.
So you need to eat.
So Nicci, let's dive into that, because this idea of weight loss means less food.
Yeah.
To some extent, yes, but rather the right food. So what is most important to be ensuring that you are eating while losing?
The thing we need to focus on, especially when you're looking at especially extreme weight loss, is not losing, or is losing as little muscle as possible.
Okay.
And the only way we can do that is by consuming protein.
Right.
And the only way we can do that is getting in a complete stack of amino acids, and that comes from animal protein. So there is a specific formula based on what you weigh and what you want to weigh, where we work out exactly how many grams of protein you need per meal to sustain that, or to even grow muscle.
Okay. Mark, Nicci, we could go on for hours, because this really is, we're breaking into the things that most of us are dealing with on some level. But I think just to get those aiming to lose the weight and get back onto a healthy track, it's been a great discussion. So thank you so much both for joining us.
Thank you.
Thank
Great
you.
stuff.